So every year, the American Diabetes Association drops its new standards of care. But let me tell you, the 2025 update is a big deal. It's not just a few tweaks. We're talking about one of the biggest shifts we've seen in a long, long time. So let's get right into it and break down what's new and what it really means for managing diabetes today. Okay, so I want to start with a direct question for you. Is the way you're managing your diabetes really up to date? Because honestly, after we go through these new guidelines, your answer might totally change. And really, that's the main idea behind this whole thing. We're finally moving past that old school one-size-fits-all model. In 2025, it's all about making care that's super personal, incredibly comprehensive, and actually empowers you to be in the driver's seat. Okay, let's dive into this first big change, because it's a fundamental shift in philosophy. It's all about how we talk and, more importantly, how we think about diabetes. It all kicks off with the words we use. The new standards are really emphasizing what's called person-first language. And why does this matter so much? Well, because a person is so much more than their diagnosis, right? It's about seeing the individual first, the whole person, not just the condition. And this is a perfect example of what I'm talking about. We're moving away from calling someone a diabetic. That word can feel like a label, like it defines everything about you. Instead, the new standard is person with diabetes, or PWD for short. It might seem like a tiny change, but believe me, this shift in perspective is absolutely a cornerstone of these new guidelines. Okay, now for the other huge mindset shift. It's this new idea called CKM health. That's cardiovascular, kidney, metabolic health. Basically, instead of thinking about blood sugar, your heart, and your kidneys as separate buckets, we're now looking at them as one big interconnected system. What affects one affects them all. So your care plan shouldn't just be about hitting a blood sugar number, it needs to protect your entire body. So if we're not thinking about the whole system, what does that actually look like in practice? Well, it means we're officially expanding the focus way beyond just blood sugar. And I mean way beyond. For the very first time, weight management isn't just a nice-to-have side effect, it's being called out as a primary treatment goal. There's a much stronger push for getting ahead of heart problems, being proactive. And we're seeing new attention on things that were sometimes on the back burner, like liver health, bone health, and even your dental health. It's all part of the complete picture now. Just take a look at this flowchart here. It perfectly shows this new, almost aggressive approach to protecting your heart. It's like a roadmap for doctors. You see, it starts with the basics, like lifestyle and statins, right? But it doesn't just stop there. If those targets aren't being met, the treatment gets ramped up. The big takeaway here is that it's not just about lowering cholesterol anymore. It's about hitting a very specific, protective goal to actively stop heart problems before they can even start. And speaking of all these systems being connected, even the name for fatty liver disease is getting an update. We used to call it NAFLD, now it's MASLD. And the most important part of this change is swapping non-alcoholic for metabolic dysfunction associated. This is huge because it officially and directly links liver health to diabetes. It's no longer a separate issue. It's a key part of the condition that needs to be monitored and managed. Okay, so all of this, thinking about the whole body, the interconnected systems, it all leads to our next big theme, personalization. Because if we're really treating the whole person, then we have to admit that everyone is different. And if everyone's different, then their goals should be too. The days of one size fits all are officially over. I mean, think about it. For decades, it felt like diabetes care was just about chasing one specific number. But does it really make sense for everyone, no matter their age or how healthy they are, to be aiming for the exact same A1C? According to these new standards, the answer is a big, loud no. This chart right here is probably the best visual for this new personalized approach. Just forget about that single magic number for A1C. As you can see, the ideal goal is now on a sliding scale. It's a whole spectrum that's tailored specifically to you based on a bunch of different factors. It really all boils down to a personal balancing act. So on one end of this spectrum, you might have someone who's younger, generally pretty healthy. For them, a tighter goal, say under 6.5%, makes a lot of sense. But then you look at the other end. Maybe you have an older person with other health complications. For them, the risk of hypoglycemia, dangerously low blood sugar, is much higher. So a less strict goal of 8.0% or even a little higher is actually the safer and smarter path. It's all about weighing the pros and cons for each individual person. And you know what makes all this personalized care possible? Better tools. Technology isn't just for a select few anymore. It's quickly becoming a standard part of care for so many more people. And this right here is a massive, massive change. The official recommendation for continuous glucose monitors, or CGMs, has been expanded. We're not just talking about people on intensive insulin anymore. The new guidelines suggest them for all people with diabetes who can use them, basically right from the get-go.
So what's the big deal with a CGM? Well, its power is in the data it gives you. It's like having a constant stream of feedback. You can literally see in real time how a certain meal or a workout affects your glucose. This helps you and your doctor make way smarter decisions. It helps you head off those dangerous lows and really just stay ahead of any problems before they start. And you can share that data so easily with your care team. It's a total game changer.
Okay, so we've talked about the new philosophy, the bigger focus on total wellness, and the new tech. Let's pull it all together and talk about the most important part. What does all this mean for you? And how can you actually use this information?
Think of this knowledge as your new toolkit. It's here to help you start a totally different kind of conversation with your healthcare provider. You're not just a patient anymore. You're a partner in your own health.
So, next time you have an appointment, you can walk in ready. Think about asking things like, based on these new guidelines, is my current A1C target still the right one for me? Or could a CGM help me get a better handle on things? You can also ask, should we be looking at medications that don't just help my blood sugar, but also my weight, heart, or kidneys? And don't forget screenings. Are there any new screenings I should get for my heart, kidneys, or liver? And hey, with sleep getting more attention, you can even ask how your sleep quality fits into your overall plan.
Look, the whole world of diabetes care is shifting. It's moving away from just focusing on one number and toward a big picture strategy for your total wellness. Yes, it's a little more complex, but it's also so much more powerful and personal than it's ever been. The standard of care is evolving, so the only real question left is, are you ready to be a partner in it?